Hello everyone, continuing on the healthcare quality subject, like high value care. So this small presentation is about the potential where we can have healthcare waste. So the acronym you can remember is TIMWOOD, and we'll talk about each category. So for example, transport waste. So suppose the services are at distant, like your lab is on second floor and your Excel is on the first floor and patient is on the ninth floor. So does transportation waste a lot of resources. The second one is inventories. If you don't need 20 ml syringes, in the unit, why keep it? So that is waste of inventory. Then motion, like I gave you example of services. Make sure, or even if the inventory is kept in a room which is people have, like, they made a spaghetti diagram, like you have to really go in a Brownian movement to get your equipment. So that is a waste of motion. Then of course in clinic setup, no shows or no appointments is a waste. So that's why to have a system where pre-appointment schedule is made, a reminder is made. These days patients do get a reminder so that we don't waste time in waiting. Then over processing, this is something we talk about in our day-to-day practice, and I have a separate presentation on that there is nothing like a routine lab or a daily lab. So that is really over processing, and that's waste of a lot of resources. Then overproduction, we do things which is not really of significance, and we extend. For example, if the unit has a capacity of 30 patients and average daily census is 26, there is no point making it a 40 bed. It's a waste of, it's an overproduction. Then of course defects, like for example, length of a stay. Your length of a stay is too long. This is the defect in the healthcare system. The patient unnecessarily stays. So you have to make sure if patient meets discharge criteria, send the patient home. And waste of his skills. For example, surgeon is there and he's called and the OR is not ready. It's waste of his expertise and his skill. And call for sedation when the patient is not there. Or most likely the newborn hospital has faced it, that there is a delivery call and they go there in the delivery room and the patient, the mother is not even in the OR. So that's waste of the resources and the skill of this patient, of this physician or provider. So the main point is that we should not be really using resources like right and left. We have to be very critical. Like I said, choose wisely and make sure we are not a part of healthcare waste. I hope it helps. Thanks. Bye.